Could the foods you eat every day quietly increase your cancer risk? Now, I know, it's a pretty provocative question, right? And Dr. Carter points out that the answer might totally surprise you. Look, I get it. Questions like this can immediately trigger some anxiety. But let me assure you right out of the gate, we are only looking at what the science actually says. There is absolutely no fear-mongering here. We're just going to lay out the evidence clearly and logically so you can really understand the exact mechanics of your everyday dietary choices.
Okay, let's dive into this. Section 1, the bigger health picture.
So, before we even attempt to demonize any single food, we really have to deeply understand the baseline. Your cancer risk, it's not just a simple straight line. It's actually this incredibly complex, interconnected web. As Dr. Carter's research points out, your long-term health is heavily influenced by these 5 specific factors, all working together: diet, exercise habits, smoking, alcohol consumption, and of course, genetics. You see, they all interact. You can't just isolate one of these bullet points and blame it for the whole shebang. Your body is a highly dynamic system, and all these lifestyle and genetic elements are constantly talking to each other. And that brings us to this incredibly reassuring quote straight from Dr. Carter. No single food causes cancer on its own. I really want that to sink in for a second. If you're someone who's trying to optimize your health, this is actually super empowering. It officially busts that pervasive myth that eating one specific thing, say grabbing a hot dog at a baseball game, is going to definitively and instantly cause disease. The science tells us that's simply not how it works. Section 2, processed meats and cancer risk. Now, when we do look at specific dietary links, processed meats are right front and center. We're talking about everyday staples here, like bacon, sausages, hot dogs, and salami. The medical data is actually crystal clear on this one. These specific processed meats have been directly linked to a higher risk of colorectal cancer. But hold on. Remember that context we established just a minute ago? The science specifically shows that this risk is associated with eating these processed meats frequently, over many, many years. It's really that sustained, long-term, frequent exposure that creates the biological link to colorectal cancer. I know that can be a pretty heavy fact to digest, so let's quickly follow it up with a stabilizing quote from Dr. Carter. Moderation is always the healthier choice. See, this is exactly why total panic just isn't necessary. You don't have to walk around terrified of food. Mindful moderation really is the key. The science isn't demanding absolute perfection from us. It's simply suggesting we pay a bit more attention to the frequency and Section 3, the obesity domino effect. Let's explore a super fascinating chain reaction here. I want to walk you through this surprising 3-step domino effect. Step 1 is eating highly processed foods. But here's the twist. These foods don't necessarily cause cancer directly. Nope. Instead, they lead to step 2, which is contributing to obesity. And it's actually step 2 that triggers step 3 because obesity itself is what increases the risk of several cancers. So the highly processed foods kind of act like the driver, but the obesity, that's the true risk multiplier in the body. It's a biological domino effect that starts right on your plate but compounds throughout your entire metabolic system. Section 4. Small, healthy daily choices. On the left, we've got the warning foods. You know, the highly processed drivers of that obesity domino effect we were just talking about, like burgers, fries, donuts, soda, and chips. But over on the right, we have Dr. Carter's empowering, holistic list of healthier alternatives. By intentionally choosing more fruits, vegetables, and whole grains, and pairing all of that with regular physical activity, you are actively disrupting that domino effect. You're literally shifting the balance of that interconnected web of health we looked at earlier entirely in your favor. I really want to drive home this inspirational takeaway from Dr. Carter. Small, healthy choices every day can make a big difference. This is the ultimate conclusion of the science here. Your daily, moderate decisions have a massive compounding impact on disease prevention over time. You are fully equipped to manage this. Every meal, every snack, every decision to just get up and go for a walk, it all adds up to a profound defense against long-term health risks.
Which leaves us with one final thought to close out our explainer today. What small, healthy tweak will you make to your daily choices starting today? The science totally gives us the roadmap, but it's up to us to actually take the steps. I highly encourage you to apply these insights to your own life right now, no matter how tiny that first step might feel. And hey, if you found this breakdown helpful, share these insights with someone you care about. Thanks so much for hanging out with me, and stay healthy out there.